Dr. Kebri Banerjee. I am the Medical Director of Advanced Fertility and Gynae Center. It is a state-of-the-art fertility center in South Delhi, very much accessible to everyone. I have done my MBBS and MD from All India Institute of Medical Sciences, and then I went to UK to train in IVF. I was lucky to get the prestigious Commonwealth Scholarship. I also completed my MRCOG in Obs and Gynae in London, and there, after having trained in IVF, I worked for 3 years as a consultant in IVF. I then came back to India and established various corporate IVF hospitals in the vicinity of South Delhi, which all ran successfully. Having done this for about 4 years, I thought it was time to start my own center, and therefore we established Advanced Fertility and Gynae Center. I have been lucky to be trained in the best institute of the country and the world. So I got my training from All India Institute of Medical Sciences, and then I have received the Commonwealth Scholarship, and after that I got training under Mohammad Taranisi, who is considered one of the best IVF experts of the world. After having done that, I have also got the Bharat Ratna Award, the India Excellence Award, and Prime Medical Excellence Award to have done pioneering work in this field. We are aiming to move ahead so that our work speaks for itself. In infertility, satisfied couples, patients who are getting pregnant are more important than anything else. So our focus is on ensuring that any couple who walks down to us through the door goes back with a baby in their hands. And therefore, our training is at all levels. The doctors, the nurses, embryologist, OT technician, anesthetist, and even the admin staff are trained so that they are able to handle the patient inquiries, complaints, and are able to address each and every one to satisfaction. As has been told, our OT laboratory are up to the international standards. Our staff is trained in such a way that we are able to handle right from ovum pickup, egg culture, embryo culture, blastocyst culture, assisted hatching, PGS. All the techniques are available in our center, and we are able to give the best to our patients. If there are patients with ovarian cyst, myoma, fibroid, polycystic ovaries, endometriosis, we are able to handle through endoscopic techniques and medications. If they are men with low sperm count or absent sperm count, we are able to do ICSI, modified IMSI, testicular biopsy, sperm extraction. All these methods are available at our center. Our future plan is to have more centers so that more people in the vicinity of Delhi, NCR and beyond are able to get good quality treatment. However, our main focus is the Advanced Fertility Gynae Center at South Delhi, which we want to make the best center not only in India, Southeast Asia, but also the world. And for this, our results will speak for themselves. We have been attending international congresses. We have also given our papers in foreign forums to showcase our work, and therefore our program and our final vision is to give the best, compassionate, scientifically right treatment to our patients, which will be the best not only in our country but also in the world.
their IVF treatment, whether it's IVF or IUI or any sort of treatment, we counsel each and every patient. We try to understand what they want for. Before payments are done, we explain each and every patient what payments we are taking and how it has been done. We explain each and every procedure before the procedure is done. We thanks all our patients and we have a very good success rate. Thanks for everyone in our team. We have an excellent team. I think it's the best IVF center in Delhi. Thank you.
हम अपने पेशेंट को सारी मेडिसिन यहीं से प्रोवाइड करते हैं और इंजेक्शन को हम कोल्ड चेन में रखते हैं और सारे पेशेंट को हम मेडिसिन आइस पैक करके देते हैं.
IVF means in vitro fertilization, in which we are taking out the eggs from the female partner and taking the sperms from the male partner and fertilizing in the lab, and the resulting embryo we are transferring in the patient only. So there are many factors in which we are so there are many factors in which we are doing this IVF. Some are male factors, some are female factors, and the combined factors also. Male factors normally when the sperm count is very low or when it is nil, that means there are no sperms in the semen. And in female there are various factors like ovarian factors, like in cases of severe degree of PCO, or in cases of endometriosis, or in cases of tubal factors like when there is tubal block, in cases of uterine tuberculosis, or you can say also in cases of unexplained infertility. And normally the IVF process starts from first or second day of the period of the female partner. We are giving the injections for 9 to 10 days, but in between on 5th or 6th day of the period we are doing the first one scan for follicular monitoring to check the size, basically to decide the dose of the injections. From first or second day of the period, when we start the hormonal injections for the patient, and normally we are giving the injection for 9 to 10 days. First scan we are doing on 5th or 6th day of the period to see the size of the follicle and we are deciding the next dose of the injection. On 9th or 10th day we are doing the final scan, and then we are deciding for the date of the pickup. Normally on 12th or 13th day of the period we are doing the egg pickup of the patient. On the same day we are taking the sperms from the male partner. Fertilization procedure is done in lab by the embryologist, in which eggs and sperms are mixed either by the plain IVF treatment or by the ICSI procedure, and the resulting embryo we are transferring on 2nd, 3rd or 5th day after the procedure. And after embryo transfer we are giving some medication for 2 weeks in luteal phase for the after the embryo transfer we are giving the medication for 2 weeks in luteal phase and doing the blood test that is called beta HCG after 2 weeks to confirm the pregnancy.
We have many international patients for infertility that we communicate through by email, phone calls and Skype.